Morning. Thank you everyone for joining us today for our business workshop. We know this is a difficult and uncertain time for all of us. The Chamber is doing all we can to provide information and resources to our members. Our entire community has been affected by the COVID-19 pandemic. For those non-essential, non-critical infrastructure businesses who had to adjust to state and local shelter-in-place orders, the question has always been, when will we be able to return to the workplace? Today, we discuss best practices for communicating with your workforce on their return, the protocols that should be in place to keep everyone safe, and how to stay in compliance with the CDC, OSHA, the ADA, and other federal, state, and local laws. This program will feature attorneys from Norton Rose Fulbright's Austin office who will answer all of your questions. I would like to thank our sponsors for supporting the Chamber programming. Our exclusive pivotal partners are Amazon, Ascension Seton, Home Depot, PIMCO, and Wells Fargo. And thank you to our foundation partners. And of course, to our corporate partners. Our business workshop is designed to provide great insight, plus give the audience an opportunity to ask the panel anything. Please note, this will be recorded and posted on our website. And now I'm going to introduce our moderator for today. Mario Pereira has 25 years experience handling first chair cases and trying those cases to verdict. Mario is a partner in Norton Rose Fulbright San Antonio and Austin offices. A portion of Mario's practice involves rendering legal advice and opinions on a variety of issues, including all facets of discrimination, harassment, retaliation, wage and hour, restrictive covenants, employee agreements, separations, OSHA, ERISA, and collective bargaining issues. Mario has conducted both employment investigations and training seminars for a variety of clients. He was certified in labor and employment law by the Texas Board of Legal Specialization in 1989. Thank you so much, Mario, and I'm going to let you take it from here.
All right, appreciate it. Thank you, Dana, and good afternoon to everyone. Again, as Dana introduced me, my name is Mario Pereira. I am here in Austin and in San Antonio, where I do employment and labor law. I am joined by three of my esteemed colleagues at this same office, and I'm going to start with Paul Trahan. Paul is a partner in the Commercial Disputes Group. Paul has been with the firm from the very beginning and brings a tremendous amount of trial experience, which I think is going to be invaluable here to this program in terms of his sections when he's talking about the liability aspects of bringing back your workforce. I'm also joined by Emily Wolf, who is an associate in the Commercial Disputes Group as well. But Emily has also been sharing her time with James Hughes and myself in employment and labor, has already spoken on a number of our webinars, and we really value her time and her assistance. And then finally, I have James Hughes, who is, as I've described to everyone during our Lunch and Learn programs, when we could have Lunch and Learn programs before March of this year, is my right hand. James has been with me on all our litigation cases and has provided the advice and counsel to clients, as especially during this COVID crisis that we've had. So I want to welcome Paul and Emily and James to the group. Thank you all for joining us. I will be moderating, but I will also be speaking at various times. And let's go ahead and sort of get started with the program, because we've got a very full agenda and we are going to do our best to cover it all. And we encourage questions and answers. We, as indicated, please send them through your Q&A box, and then we will take them up at the very end, and Dana Harris will be reading those. But for right now, I want to sort of start the program by telling you what it's not really directed to. And it's those businesses that are deemed to be essential businesses, critical infrastructure businesses, utilities and whatnot, and of course, healthcare. And why is it not directed to them? Well, their description and their names alone say it. They have been at the forefront, and they never went home. They've never been working remotely. Some limited staff have, but for the most part, they've managed to stay open, and they've been working, they've been managing through this crisis So they have a wealth of experience. If any of them are listening in, we welcome you. But a lot of what we have to offer and the advice we're going to be providing are to the businesses that don't fall within those categories, and that's everyone else. And so with that being said, we thought it'd be interesting to start the program with sort of an overview of how we got here. And so I'm going to turn it over to Emily, who is going to take us through an interesting timeline. So Emily?
Yeah, thank you so much, Mario. And I'm just going to apologize in advance for the fact that my cat might be jumping up on the screen. She loves webinars, wants to be an internet star. So apologies for that. I think James is throwing our slides up on the screen right now. But the first one that we have here that you'll see in a sec, there it is we wanted to put together this timeline to show just how quickly things have changed with regard to COVID. You know, you can see that the first report was a cluster of pneumonia cases. We didn't even know what this was in the end of December 2019. It wasn't until, let's see, the first reported case of the virus in the US was actually a couple of weeks after the first report of the cluster of pneumonia cases. About a week after that, the WHO declared a global health emergency. The virus doesn't get a name until a couple months later. February 11th, 2020 is when the WHO gave the virus an official name. That's COVID-19, as we all now know. And then in the US, a few weeks after that was our first reported local case of local transmission. And what that means is, you know, it's not a person who had traveled to Wuhan like it was in January. It was just a person who got it from other people in the US. So that was a pretty big deal. February 29th, we have our first reported death. It turns out actually our first reported death probably happened later. You'll see our little footnote. In April, it was determined that actually the first actual death was probably February 6th in California. By March 11th, just about not even 3 full months later, the WHO declared a worldwide pandemic. March 17th, 6 days after that, West Virginia reported its first case, and therefore the disease had been present in all 50 states in the US. About a week after that, the city of Austin and Travis County issued shelter-in-place orders, and at the end of March, our governor, Greg Abbott, issued an executive order mandating that we minimize social gatherings and that we do not have in-person contact except for essential services.
There we go. Sorry about that. Emily, let me just add that with regard to the timeline, as you've emphasized, ladies and gentlemen, this isn't even 6 months ago. If you sort of go to where we were 6 months ago, the idea that we would be having a program of this nature through Zoom because we can't sort of be close to one another would have been unheard of. The case of local transmission in California is important as well because we didn't understand the concept of an asymptomatic individual. The individual that passed away in California or that contracted the disease had not traveled to China, had not been exposed to anyone yet of this disease, and yet we now know, we understand the concept of asymptomatic, carriers, so to speak. So, Emily, where are we right now in terms of the numbers? Because the timeline is interesting enough, but where are we on the numbers?
The numbers, I mean, the numbers are staggering. You see in the world as of, June 17th is when our data is from. So, yesterday, 8.3 million reported cases. And I mean, as you pointed out, that's 6 months ago is when we first started seeing this. So, I mean, that's huge. We have 447,000 deaths worldwide, 2.162 million reported cases in the US alone. So we in the United States are accounting for like a fourth of the reported cases. Texas has a decent number, 97,000 reported cases, and we have 2,000 deaths here in Texas. And then Travis County, 4,600 reported cases, and at the moment, 106 deaths, although I think the data kind of changes depending on where you're looking.
Right, and that's another important point to bring up, and that is for those that are on this webinar today. If you happen to pull up the CDC's numbers, you're going to see lower numbers, slightly lower. They're still within range, but they're lower numbers. I'm not sure any of us have an explanation as to why. A highly regarded medical institution like Johns Hopkins is reading it one way, and the Centers for Disease Control are reading it slightly different. But the point is, these numbers, as Emily have said, are staggering when you think about where the U.S. stands worldwide in terms of cases and deaths. And what we're seeing right now, and then I'm going to sort of turn it over to James, and that is, we keep hearing this sort of narrative about a second wave. And I will tell you, from a medical perspective, I am married to a doctor, and I sit on a number of community boards with medical experts. I'm not sure that we ever flattened the curve on the first go around. New York says that they have. I'm not sure I see what New York is seeing, but I still see somewhat of a parabolic sort of curve. But whether we're still in the first wave or we're in the second wave, we're seeing such huge spikes locally that kind of feeds, it's a great segue into James, your portion to talk about exactly what are these orders sort of covering. And we've had some recent developments, in fact, very recent developments here in Travis County and the city of Austin, haven't we?
Yes, thanks, Mario. That's right. So just for context, we started to reopen on May 1st with Governor Abbott's phase 1 of his reopening plan. And as many of you are no doubt aware, the idea was to institute a cautious reopening at 25% capacity for a number of retail and kind of face-to-face in-person businesses that otherwise had been shut or had been reduced only to takeout orders during the shelter-in-place period. So, for example, retail stores reopened, restaurants, movie theaters, museums, and libraries, but all at only 25% capacity, which, to my understanding, frequently made it economically problematic to even be reopened. Now, starting in mid-May, starting with May 18th and running through the 31st, there was a series of phased additional openings of additional businesses being allowed to open with highly specific requirements and limitations put out by the Department of Health and Human Services and other agencies. And the establishments that were already able to open at 25% were able to increase to 50%. And that is still where we are today, with the caveat of what's happening locally here in Austin and Travis County. Now, early on, Governor Abbott took the position that his orders preempt the state orders. And there's some irony here where early on, local authorities like Mayor Adler were calling upon the state to issue statewide preventive measures to prevent the spread of the virus. Well, be careful what you wish for. Then they got statewide measures and then started complaining that the statewide measures kept them from doing their own local measures. But that's where we are. Mayor Adler on the 15th extended his shelter-in-place order. So it's still in place. Attorney General Paxton at one point threatened to sue local authorities if they exceeded Governor Abbott's order. And then, hot off the presses, on the 16th, Mayor Adler and 8 of the other mayors of all the largest cities in Texas, wrote to Governor Abbott pleading to be allowed to force people to wear masks out in public, because there's new studies saying that might make a huge difference. Just yesterday, Governor Abbott gave a press conference where he, or actually really an interview, not a press conference, and he said something to the effect of, the government can't require individuals to wear masks, but you can require stores and businesses to require their customers to wear masks. And so within hours, Mayor Adler issued a new order requiring masks. So to recap where we are in Austin, Texas right now, we first have the shelter-in-place order that was extended to August 15th. Now, it has, on the face of it, some very strict limitations. Limits gatherings to 10 or fewer people, or 2 if you're in an at-risk group. But note the big carve-out, except as permitted under Governor Abbott's Order GA 26. That's the reopening order. So if you're a business that is authorized by the governor's reopening orders to be in business, essentially the local shelter-in-place order doesn't really apply to you as long as you're acting within the confines of the governor's orders. Now, if you're not within the confines of the governor's orders, then Mayor Adler's order has some teeth. It's a crime to violate it, up to $1,000 misdemeanor. It's got exceptions for members of the same household and whatnot. And beyond that, though, it's advisory. It says literally, even if you're reopened under Governor Abbott's order, we strongly encourage you to operate at a lower capacity while the city's at stage 4 or higher. And you haven't been watching the news, we are at stage 4 or higher because there have been, on average, 20 or more new admissions to the hospital with COVID in the past week. Now, I mentioned that Mayor Adler issued a new order last night. What is that? So this is a new order that mandates essentially all commercial entities in the city of Austin provide goods or services directly to the public. So that's most businesses have to develop and implement a plan for health and safety that must, at a minimum, must include a requirement that all employees or visitors wear a face covering. There's some very common sense exceptions if you're a person working in an individual space alone without anybody else around, or if the only people around you are members of the same household and whatnot. But no real loopholes there that would apply to a normal business in a normal setting. So that probably applies to a great many of the businesses represented on this webinar. When you have to have the policy implemented and in place and posted where your employees and visitors can see it by June 23rd. That's next week. Now, sorry, Mario, I might want to say something before I turn it over.
So James, let's kind of sort of synthesize it. For businesses that were thinking they were going to be able to come back by this coming week, you've indicated that the order is advisory, but yet strongly sort of has some teeth to it. And I know that we're going to go to Paul in terms of how you talk to your workforce about coming back. But is there an issue here in terms of businesses that would want to come back early, trying to follow the governor's order, or what do you recommend? So
your first point of call is still the governor's order and the guidance from the state agencies, particularly HHSC, which has separate guidances for different types of businesses. For example, there's a specific document for office type environments, such as our law firm would be if we were back in the office. If you are able to figure out that you are operating under Governor Abbott's orders and the guidance of the state agencies, and you comply with those orders and guidance, then you're in compliance and you shouldn't fall afoul of the Austin or Travis County shelter-in-place orders. The issue is if you're going beyond what the governor has authorized.
All right. So Paul, we get to a point now where a business is thinking about, coming back to work, and many of them, as I've indicated, have, and now they're having to sort of rethink where they're going to be given the mayor's recent order. How do you talk to your employees so that you can, for lack of a better word, get their buy-in?
I think one of the best practices is to engage in a dialogue. The title of this slide is how to best talk to your employees. And the general topic of our discussion today is about liability, potential liability, and hopefully your goal is not only to avoid liability, but to do what's in the best interest of your employees. And in order to do that, the first step is to create a dialogue where you can listen to your employees and hear what they've got to say. And what we've seen many employers do is they send a short survey to their employees. It can either be a formal survey. There's a ton of software available out there to generate and implement brief surveys to your employees, or you can do it less formally. But just get a sense of what your employees' level of anxiety is about returning to the workplace. The benefits will be tremendous. Not only will you gather useful information, but you'll convey to your employees that you care about their safety and that you've got an ear to their concerns and are listening to their concerns. Unlike anything we've ever seen with this virus, the information is changing rapidly. So many of your employees will have as good information as you have in terms of how the virus can be spread, what the circumstances are, what the best practices are for protecting themselves. So if you listen to your employees, you put yourself in the best position to make informed decisions about how best to protect their health. We've listed here a number of specific recommendations. I won't go through them specifically, but you know, what you'll see in some of the cases that I'll discuss later is things that get people in trouble is sort of taking a cursory approach to these safety measures, not taking them seriously. I think you need to be deliberate about it. You need to have measures in place. Sort of basic, fundamental best practices are have a series of questions to ask your employees about their current state of health and whether they've been in contact with anyone they suspect may have been exposed to the virus. Regardless of your view on masks, that is best practices. We recommend that you require your employees to wear a mask where practical, especially indoors in close proximity. And we've heard enough about social distancing, which is not a phrase any of us had heard of until just a few weeks or short months ago. But now it's become something that everyone understands, and best practices definitely include social distancing. I do a fair amount of work with the construction industry. The city of Austin has published some guidelines for construction sites that are very useful, and I encourage you to go on their site and take a look at those measures. They include basic things like hand washing stations, sanitizers, distancing, regular cleaning of surfaces in work areas. There's some practical things you can do. And above all else, talk to your employees about it. Communicate to them that you take this seriously. Communicate to them the measures that that you're taking to protect them, so that they can provide their feedback, and so that you can take their feedback into consideration in formulating the appropriate protocols.
Thank you, Paul. You know, I do think that there is a lot of value to what you said in terms of keeping that line of communication open, always the ongoing dialogue, and the importance of showing your employees what you're doing, the protocols that are in place for their safety. And really the one thing that I think a lot of employees are going to be asking their employers is, what protocol do you have in place in the event that there is a positive test? And I think that that's what they want to know, that you're ready, that you've got a plan in place. And that really sort of segues into now the portion of the presentation that James and I are going to be handling. All right, so, you know, we've got these orders. The businesses have made a decision that they're ready to come back, or they're going to be coming back in the foreseeable future. They're having this ongoing dialogue. What is it that they have to look for? You know, what traps, you know, what areas, and we're going to lead into the liability later, but what is it that the Centers for Disease Control and OSHA have? So James, why don't you go ahead and start with the CDC aspect of it?
Thanks, Mario. So the CDC has issued highly extensive guidance about every aspect you can imagine of making almost any space as safe as possible from the virus. I'm going to highlight two in particular that you might not be as aware of just from what you would have picked up from, you know, news stories. And I'll leave some of the others to Mario's discussion because they overlap a lot with what OSHA has put out and what some other recommendations we'll cover would suggest that you do. But one I wanted to highlight, which was interesting to me, is that the CDC really emphasizes the importance of ventilation and of calibrating your ventilation, your HVAC system, to help reduce the likelihood that you know, water, aerosol or water droplets are floating through the air containing the virus that can infect people. And so I won't go over all of these because I'm not an HVAC engineer and don't understand them extremely well. But the point is, you want to reduce the likelihood that you're all sitting in the same pocket of air that's not, getting changed out. You don't want air to be recirculating through the same space over and over again. Instead, they suggest increasing the ventilation rate, increasing the exchange of inside and outside air. So you're sending the inside air out and bringing fresh air in from the outside, upgrading the filters to MERV 13 or whatever level you can manage, and making sure they're installed and up to date. So, and this is highly recommended by the CDC. They actually say this is more important than some of the things you might think about, like spraying down and cleaning surfaces. Now, another area they do provide a lot of guidance on is cleaning surfaces. They do recommend routinely cleaning all frequently touched surfaces in the workplace, workstations, keyboards, electronic pads, doorknobs, and if it's soiled or appears dirty, they recommend using soap and water. Otherwise, you need to use EPA registered household disinfectants that are warranted to actually eliminate viruses. They also have specific guidance on what to do if you know someone who's infected has been in your workspace. And they have a series of steps. I have put the high points here, but if you go on the CDC's Guidance for Businesses website, you'll see the details. But the first thing is to close off and evacuate the area. Then harkening back to what we just talked about, it's opening doors and windows to get ventilation going. Get the air that might be contaminated with aerosol or droplets out of there. Ideally, wait 24 hours to actually go in and clean, and then go in with cleaning personnel wearing protective gear, and again, clean all the surfaces. And with that, I will hand over to Mario to talk about OSHA guidance, which complements this.
And OSHA is, I would say right now, is in a state of flux in terms of sort of their approach. There's been a lot of criticism about what OSHA is not doing. OSHA bristles at that and pushes back pretty hard. But I think it's important for everyone to understand that at the present time, there is no specific standard on any type of an infectious disease control specifically to COVID. That being said, every employer that is subject to OSHA has a general duty under Section 5A1 of the Act to provide a safe workplace and to protect their workers from any recognized hazards. And I think it's fair to say that even given our timeline, as quickly as it's come, COVID is an absolute recognized hazard. So employers have to be on the lookout for this. There are specific regulations we'll get into, time permitting, with regard to personal protective equipment, PPE, record keeping, reporting requirements that employers have to keep up with. And there is also industry specific guidance that OSHA has issued throughout the years. And that is why they are relying on these provisions as opposed to issuing an emergency standard. Now, James, if we'll go to the next slide, here's the reason why I think OSHA has sort of pushed back on wanting to do an emergency standard. I kid you not, ladies and gentlemen, the average time to do this is about 8 years. That is how long it has taken OSHA to issue standards in the past. You could issue an emergency standard, as has been, sort of demanded by labor groups and other individuals. But the heightened standard is incredible. They've got to show grave danger and necessity, which I think would apply here clearly. The last time this was done was in 1983, and it was immediately invalidated by an appellate court. And it only lasts for 6 months. And we all know that from what we're hearing, we are going to be in this pandemic well beyond the end of this year. So, James, if we continue on with the next one, what has OSHA been able to do? Well, in early March, right around the time that we were all beginning to get sort of pushed from our various offices and onto our homes, they issued an interesting sort of pamphlet called Preparing Workplaces for COVID-19. If you want to see what it looks like, here's the picture of it on our next slide. and encourage everyone to sort of look it up and read it. It's about a 32-page document. Really gives some very, very good guidance. But it starts out at the very beginning, and it is very clear, and I'm quoting here, "This guidance is not a standard or a regulation and creates no new legal obligations." That being said, I would highly caution anyone listening to this program, and any employer for that matter, to just sort of say, well, this is just guidance, I don't have to follow it, because you're going to see the number of complaints that have been filed with OSHA have just skyrocketed, and you will get a visit from OSHA. And there is, under the general duty clause, the likelihood that you could be cited and fined by OSHA. So here are some of the things that I drew from this document. And again, because of the time, I'm not going to be able to go into all of these specifically. But so, for example, they promote frequent and thorough hand washing. They specify at least 20 seconds. They talk about, providing these facilities to your visitors and your customers. And they specify the percentage of alcohol that either the wipes or the hand sanitizer must have. They talk about, what we've all been hearing: don't touch your face, clean the surfaces, have the respiratory etiquette, cover your cough, cover your sneeze. If you're sick, go home. Don't come to work. And have everyone recognize their personal risk factors. Are you sort of immune compromised? Are you around elderly? Are you around people that have certain other, serious diseases? And then the words of discouragement, don't use other people's desks, don't use their phones, don't use any type of office supplies, and then be flexible. And that was something that Paul addressed in his portion of his presentation. And that is, talk to your employees. And if necessary, you may want to look at staggered shifts. You may want to look at flexible work schedules. You may want to look at flexible work hours. The whole point here is to get to that social distancing model, whether it's 6 feet or you want to go a little bit more. But these are the type of measures that OSHA has set forth in that guidance. So, James, the next slide. It also recommends that employers consider creating an infectious disease preparedness and response plan. Again, they look at where are you on their sort of diagram, their triangle of risk association, and to weigh the individual factors and figure out what controls you need to put in place to be able to go forward. So, James, there is the sort of diagram that OSHA follows. It's nicely color coded, and very simply, it just talks about the issue and what is the best sort of measure. And if you sort of go to the very top, well, your best measure of eliminating the risk is always going to be eliminating the risk. Well, we know that with COVID, we can't do that. That's not going to be practical anytime soon. So what you do at this point is, what's the next best one? And that's, you replace the hazard, you substitute it. You sort of start getting into these engineering and administrative controls. You have your signage, you have your social distancing, you put these plexiglass sort of shields where they prevent anyone from being too close or possibly transmitting the airborne, droplets and whatnot. And then obviously your PPE. And we all have been told time and time again that a mask is incredibly helpful, but it's not going to keep you from getting sick. And that's why they put PPE at the very bottom of that triangular, sort of formula. So what else do they recommend on this infectious disease? Well, you're supposed to follow all sorts of recommendations, both from the federal all the way down to state, local, territorial. If you happen to be in Puerto Rico, if you happen to be in a state where you have Native American tribe, they have issued their own recommendations. And then what happens when you have a second outbreak, as we're beginning to have right now? Again, these are all things that we've talked about: the need for social distancing, And then you really, as an employer, need to be prepared. We've all seen the shortages that we were hit with back in the March and April timeframe. Are you prepared for those same sort of shortages and events to happen again? Are you cross-training? Should you cross-train your employees? And I think the answer is absolutely yes, so that if you have to work with a reduced or a skeleton crew, you're able to be more effective than you were maybe in the March and April timeframe. You have to plan around interrupted chains of delivery, supply, et cetera, because we've seen it happen earlier this year. Go on, James. There we go. And then just besides OSHA's guidance, these last few slides, before we get into the protocols, talk about what Congress has done. And I won't belabor the point. The HEROES Act does, I think, a very good job of providing a lot of guidance. Unfortunately, it's stalled in the Senate right now. And so we haven't seen it enacted into law. So there's really been no sort of help from Congress to help OSHA along. And then the litigation aspect of it, James, which we'll go on to again, given time. In May of this year, the AFL-CIO, the large labor union, issued or filed a writ of mandamus with the DC Circuit, basically pushing OSHA to issue that emergency standard that we talked about earlier. And within less than a month, the DC Circuit rejected that petition. And I quoted their order, which is very brief. It says, in light of the unprecedented nature of COVID-19 pandemic, as well as the regulatory tools that OSHA has at its disposal to ensure that employers are maintaining hazard-free work environments, OSHA reasonably determined that an ETS is not necessary at this time. And so if that case is gone, will there be other challenges? Maybe. I doubt it, given what the DC Circuit has done already. All right, James. So let's talk about creating protocols. Emily, you and I are going to be doing this, and I'm going to go ahead and take the next few slides and then turn it back over. Again, I showed you an earlier chart of sort of an upside down triangle that OSHA uses. This is the right side triangle that you use to assess workplace risks. All right, and we gave you some examples. High and very high exposure risk jobs obviously goes without saying. Hospitals, nursing homes, medical transport, emergency services. The medium exposure risks, schools, meat processing plants, we've heard enough about them, or a lot about them recently in terms of the number of cases in those settings, and obviously the retail settings. And then finally, the lower risk jobs, lawyers, engineers, those kind of office settings where you can maintain social distance and hopefully stay safe. So I would presume most office jobs. All right, what I'm going to cover very briefly are just sort of some protocols that we come up with as a firm that we've given to our clients. I'm going to cover the people and places, and then Emily's going to cover hygiene and other areas. And again, given the time, I wish we could go really in depth into each of these, but I'll read a couple of them. Obviously, you start out, and again, tying back to Paul's portion of the presentation, communication with your employee. What's the best way to tell them that you're taking care of them? Is you're going to provide, face coverings, masks, whatever, at no cost to them. Have an adequate supply so that you're always able to take care of your employees. Train your employees. If they're having to do more than wear masks, if they're having to wear face shields, if you're doing temperature checks at the beginning of the workday, and you're having the person doing the temperature check donning a face mask and a full smock and whatnot, train them on the donning and doffing, the putting on, taking off of that equipment. And again, that time is work time. Again, encourage the cleaning of surfaces. Make sure that you tell them what you're doing. Ensure 6 feet is social distance. For those of you that are like me, that sometimes have gone off and checked Netflix and old movies, you saw that old Matt Damon movie, Contagion, which by the way was very accurate. The only thing they really did different was their social distancing model was 10 feet. wasn't 6 feet, which I thought was rather interesting. Figure out what you're going to do in tightly confined spaces, your elevators, company cars. How can you prevent people from being closer to each other than 6 feet? And then on the next slide, again, have you walked out your space? Have you literally walked it out? Are you, in our offices, we've actually walked out and now put directional ways so that people are not going to be interacting in the office or in the hallways as much as they did before. Try and limit in-person gatherings as much as possible. Rely on video conferencing as we're doing here. Essential in-person gathering meetings, if they have to happen, make sure they're designed and well ventilated. Hold them in big offices, big conference rooms, and then just make sure you're cleaning and disinfecting the workplaces between users. And so those are some of the protocols that we've come up with, at least with regard to people and places. Emily, let me turn it over to you to continue on.
Yeah, sure. I just want to kind of emphasize what Mario was saying before, and James, I guess also, everyone has really been talking about this. Cleaning is super important. The CDC, as you guys saw, has given a decent amount of guidance about hygiene and sanitation. It is a great idea to follow that. Please follow that. Maintaining cleaning logs is a good way to ensure that surfaces that need cleaning are being cleaned. Make sure that they document when things were clean, sort of the time that they were cleaned and what the scope of cleaning was, like how much it was cleaned, where, all of that. Hand hygiene stations are a great idea as well. You really want to be encouraging people to wash their hands. I mean, it's a huge one. I think James might have mentioned this, just any shared spaces, like please regularly clean those, disinfect them daily, at least. You might have to be disinfecting more if necessary. And then, yeah, changing things that you used to do in order to kind of minimize exposure. So if you had like a Friday night, whatever, if you had a potluck or things like that, don't do that anymore. Communal foods are kind of a bad idea. Also, in the same vein, prohibit food being left overnight in fridges. You just don't want to have people be touching all the same surfaces, and want to minimize that as much as possible.
And Emily, let me just interrupt and just say, with regard to the communal foods, I think what we're saying in a nice way is the Monday morning donut runs that people would do, or the morning taco runs. I think we were really strongly discouraging that for the future. Everyone can bring their own breakfast, but you really are increasing the risk of these infections if you keep doing that, or if you return to those old practices. I'm sorry, I'll probably be shot for saying that, but I thought it was important to point out.
I know, I'm incredibly disappointed because I will very much miss our breakfast tacos that are regularly in the office. But, a small price to pay for safety. We also recommend that screening happen. Mandatory health assessments, we strongly recommend those. Questionnaires talking about whether or not you had experienced any symptoms, if you've tested positive, if you've been in close contact with anyone who may have had COVID. We want those to happen every day before people come into the office. We're also recommending things like temperature checks before people come into the office. It's pretty important. You should have practices in place for if someone does test positive for COVID. Make sure that they're not coming back to the office too soon. Make sure that, they don't have a fever anymore, and, not because they're taking a bunch of Tylenol, like they have to have not had a fever for 3 days. So yeah, a lot of these are a good idea. I don't want to get too hung up on them just because we are running low on time. So we can go to the next slide. Just also on-site screeners, they should be wearing appropriate PPE. We talked about how they should also be trained in the donning and doffing of that. I'm sure you've all seen masks are uncomfortable and people don't put them on or take them off right. So it's very important to make sure that we have, screeners that actually are doing that appropriately, and so as to minimize any exposure. It's also a good idea to have a point of contact for people to inform if they have symptoms. Have a plan for if someone tests positive. You don't want to have an employee come in, get sick, test positive, and then you have to scramble to figure out how you're going to clean everything, or what you should clean, or how you're going to get everything so that it's safe for the other employees. And then require that employees who are sick stay home. That's just, I think we can all agree that you really, really don't want sick employees in the workplace right now. And I think after that, I'm turning it over to, is that Mario and James that I'm turning it over
well,
to?
that's all of us. And, this is sort of, this is how we wrap up the program. And so we've already had some questions into sort of give us an insight into the legal risk associated with not providing a safe enough workplace. And so let's get started, James, from the OSHA perspective. Again, I go back to the general duty clause, section 5A1 of the Act. 4 elements. A hazard exists in the workplace. The hazard was recognized. The hazard is likely to cause death or serious physical harm, and there was a feasible and useful method to correct the hazard. I think we can all agree that COVID meets the first 3 elements without a doubt. Now it just becomes, what did you do as an employer to provide a feasible and useful method to try and control that? These are the protocols that we've been recommending, that we just covered, as well as all the other aspects that we've covered as well. So you do have potential liability under OSHA going on, James. Keep in mind, remember I said at the very beginning that there were other industry-specific and more specific OSHA standards. Well, guess what? Look, you have specific standards on reporting and record keeping, PPE, eye and face protection, respiratory protection, sanitation, and accident prevention signage and tags. I've listed them out for you. I encourage you all to go and look into them. This alone would probably take us another half hour to go into more detail, which we do not have, but it's important for you to understand that it goes beyond the general duty clause or other areas. James, go on. Here are the specific industry-specific guidelines. Construction workers, Paul's already referenced that there are local standards. Well, OSHA has them as well. Nursing homes, retail pharmacy workers, rideshare, taxi, car services, dental, manufacturing industry, restaurants, food, beverage, and retail workers. Every one of these has specific guidelines. I encourage everyone to read up. If need be, talk to your attorney, come up with a plan so that you know that you're in compliance with these guidelines. And then guess what? COVID is a reportable offense. Sort of incident that you would have to put down on an OSHA 300 or 301 log. It gets sketchy because you don't know if the person actually caught COVID in the workplace. You have to record it if it's a confirmed case, if it met the definition of work-related under that specific statute. And keep in mind that COVID, since it's a respiratory illness, has to be coded on as such on that form. And if the employee requests that their name be withheld, it can be entered anonymously. You don't have to identify the employee's name specifically, but it is reportable. But this is going to be the next area of litigation, and that is, was it work-related? And therefore now takes us into sort of the workers' comp area. And we'll skip over that slide. Let me just, before we get into the work-related area with James, it's important. I told you earlier how the complaints had skyrocketed, almost 5,000 complaints by June of this year, early June, and yet less than 8% of them have actually been inspected. 23 different states have their own version of OSHA, so you have to look and make sure you're in compliance there. And almost 100% of these complaints have all come from healthcare, retail, and the manufacturing area. And then there are 2 examples, actually there are 3. Intel was the subject of 41 complaints alone in Oregon. HMS Host in the Orlando airport was the subject to 35 complaints. And of course, you've probably been reading the McDonald's litigation up in Chicago. Same thing, where the employees claimed that there was not enough done to protect them. They weren't trained, the managers weren't trained. Managers are actually testifying this week talking about what they've done to train the employees. Bottom line, it's a big mess, but there is litigation out there involving OSHA. All right, James, let's go on to workers' comp.
Thanks, Mario. And so I'll just very briefly mention that you might be thinking, well, I'm a subscriber under the Workers' Compensation Act. And yes, that exclusive remedy defense is still going to be available to you for most of the factual scenarios we can come up with where an employee contracts COVID at work. But don't forget, there's always an exception to that if the plaintiff can show gross negligence. And Paul's going to talk about that in more detail in a moment. But I just want to mention out there that it's not a silver bullet, and we're already seeing cases where the plaintiff's lawyers are pleading gross negligence to try to get around the workers' compensation provisions. Very briefly, I'll mention one thing about unemployment compensation. The Workforce Commission is waiving employer chargebacks for employees who've been laid off due to COVID. And don't forget, they look back 5 quarters from the layoff to assess those. So it's something to think about if you start getting notices of maximum chargeback, that you might be able to invoke the COVID waiver to avoid the chargeback. And I'll hand it back over to Paul now, who's going to talk to us some about negligence and gross negligence.
So I'll talk about 3 cases which from which you can draw some lessons learned. One is the Princess Cruise Lines case, which many of you may have heard about. It was filed in California. It was one of the interesting things about this case. Well, the facts of the case are that it turned out there were 2 passengers who were diagnosed with COVID back in February. And then the cruise line elected to go ahead and load passengers onto another cruise ship with there were thousands of passengers, but about 60 stayed on from the previous cruise, and go ahead and launch another cruise, February 21st. So that's early on. So the cruise line can say that no one really understood the risk at that time. Whether that will be successful or not, we'll see. But no one can really say that anymore. One of the criticisms was that the cruise line failed to have proper screening protocols. They had passengers fill out a piece of paper, but no one was questioned and no one was examined. So one of the questions that we've seen on our question board is, well, what do you do if an employee comes to work sick? Well, there's a couple of ways to ferret that out. One is by asking them questions and observing them, and that is more of a subjective analysis and interaction. But also there's taking the temperature. That's much more objective and something you can measure. So that's a good practice now. Might that have avoided the situation with the Princess Cruise Line? We don't know. That was very early on. There's also a case in Travis County here, a sad case. Mr. Dotson was a healthcare worker at a nursing home. And although there had been no real incidences of COVID in nursing homes in Texas at the time, there were reports of incidences in nursing homes in the Seattle area. So what the plaintiff, his survivors, allege in that is that they failed to provide a safe workplace. And what they mean by that is that the employer did not provide a mask for the employee, Mr. Dotson, or other protective measures. We've got much better guidance now, I think, on what providing a safe workplace looks like and what personal protective equipment and practices are effective. And finally, there's the Lay versus Tyson's Foods case. As many of you may have read, Tyson Foods had a big COVID outbreak in the Amarillo area. Hundreds of employees were infected. And one of the cases arising from that incident, or those series of incidents, was a death case. where the worker or the surviving husband is claiming that his wife was allowed to work in an unsafe workplace, knowing that there was COVID in the facility. And even though it was an essential business, they should have taken measures. And this was later in the epidemic in March and April, so they should have known. So the plaintiff alleges that there was cause to take these protective measures. One takeaway from that case is that the employer had no workers' comp and no paid sick leave. So one of the themes in the plaintiff's complaint is that there was pressure to come to work sick. I've got a friend of mine who has a food business who had an employee come to work sick. Despite all the warnings and the questions, she insisted upon coming to work sick. By all means, don't pressure your employees to come to work if they're sick. And you need to screen for that, check for that, and make no exceptions to that. And with that, I'll turn it back over to the team.
All right, Emily, why don't we cover the ADA? Because I think that's probably the most important aspect of under Title VII, and then we'll wrap it up with the questions and answers.
Yeah, I think that makes sense since we're running low on time. Yeah, I just wanted to jump in really quickly and mention some potential pitfalls, and maybe pitfalls that aren't really pitfalls. Some of you might have been hearing us talking about, take your employees' temperatures, make them fill out health screenings, and thought, what about the ADA? And that's a really good instinct. As you all probably know, the ADA protects applicants and employees from disability discrimination, but it also regulates certain things like what sort of disability-related inquiries you can make as an employer. And that's for all of your employees, not just the ones who have ADA disabilities. And it also regulates things like medical examinations. So you might be thinking, COVID tests, like that seems like that would be implicated, and it is. Could we go back one? James, thank you. So really quickly, a disability-related inquiry is it's one that's likely to elicit information about a disability. So for example, asking things like, are you immunocompromised? That can be a thing that is common in people with specific disabilities. So you can't normally ask questions like that of your employees. And for our purposes, medical examinations are just anything that's going to test an individual's physical or mental impairments or health. So a COVID test would be that. However, because we are in the midst of a pandemic, it turns out you can actually ask certain questions. An employer is completely allowed under the ADA to be asking pandemic-related questions. So if you're asking your employees things like if they're experiencing symptoms of the pandemic virus, that's totally fine. That's allowed. That's not going to open you up to liability under the ADA. So it's the symptoms that we all know: fever, chills, cough, shortness of breath, sore throat. I think more have been added. I'm pretty sure muscle cramps is on there now. Things like that are fine. And you are also allowed to take your employees' temperature. Because community spread's going on and because this is a health emergency, employers are allowed to measure employees' body temperatures. I would caution you, though, that medical information about employees has to be stored separately and not in their just personnel file. You really want to be limiting access to that kind of information. Next slide, if you don't mind. Wait, where did that go? Oh, anyway. Yeah, so administering COVID tests also allowed. So the ADA actually requires that a mandatory medical test of employees be job-related and consistent with business necessity. And in this kind of situation, a COVID test it fully satisfies that, and you are allowed to administer them. And we recommend that you do. Another thing that the ADA requires is that you provide reasonable accommodations absent undue hardship to employees with disabilities. So I would definitely encourage you to, if you have employees that have jobs that have to be performed at the workplace, if you have to be in person there and they ask for a reasonable accommodation, really think about what you can do. There definitely might be some, you see here in this little picture, there's a post office and they put plexiglass up to minimize exposure. And I think Mario already talked about some really good things that you can do for stuff like that. You know, think about plexiglass, think about tables, think about, you know, one-way hallways, things like that. And since we're probably low on time, I guess I'll skip over the ADA and other things and just maybe go back, Mario, to, do we want to do questions?
Yeah, let me just, we'll wrap up, ladies and gentlemen, this way in terms of the Title VII concerns that Emily didn't get a chance to cover, and that is, keep in mind there has been a lot of reports and complaints and charges of discrimination filed on ethnic discrimination against Asian Americans being blamed for the coronavirus. Clearly, it goes beyond saying you have to have your policies in place to make sure that's not happening in your workplace. Also, you cannot be paternalistic. You cannot go out there and say, well, this worker is in the high risk category, so I really don't want him or her coming back. This woman is pregnant. I don't want her coming back. I don't want to risk the liability. You cannot do that. That is going to lead to a charge of discrimination. So be careful on those fronts. And we've had a couple of people ask if we're going to make the presentation available to them. Absolutely, yes. We will make this presentation available to whoever wants it, and it'll be probably posted on the Chamber's website. And Dana, before I turn it over to you for one or two questions, I did want to point out that someone mentioned that the Texas Restaurant Association has issued guidance on in their industry back in March, and it was it appears very helpful, and they've even given the site www.texrestaurant.org /Texas Restaurant Promise. And so for those that just want to get some guidance as to what that particular industry is doing, maybe you can adapt some best practices. I encourage you to go there as well. Thank you for sharing that. And so Dana, let's we're going to take this off and let you take over as to one or two questions with anyone that's still remaining. And we apologize for going a few minutes late, but we did want to take one or two questions.
Thank you so much. What a great presentation. I think one of the questions we have from Roxanne is, so can we ask employees for their COVID test results?
The answer would be yes. And I think that most people are actually wanting to provide that because they want to be able to show that they can come back to work. Some employers are actually requiring it. They're paying for it. But the EEOC has made a lot of exceptions in the area of the ADA, which is what Emily covered. We're not going to see these exceptions last beyond this pandemic. But yes, if someone tells you that they've undergone testing, I think an employer has absolutely the right to maintain a workforce, a safe workplace, by insisting on the results, and then keeping it confidential, as Emily indicated.
Thank you. Kendall Farley asked, if our business isn't technically open to personnel, but is allowing vendors and one essential employee access, do we still need to have our reentry plan finalized and posted?
James, Paul, Emily, y'all want to take a stab at that one?
I would err on the side of saying yes. And the reason I would say yes is because of Mayor Adler's order that was issued yesterday. If you're in another city, I'd have to scratch my head longer, but he's ordered everyone to come up with a safety plan by the 23rd that at a minimum involves face masks. You can always update and amend your plan, but I would go ahead and get a plan implemented by the 23rd in order to comply with that order. And let me add one thing. It doesn't have a carve out for the facts you described, where you're not really fully open to the public. It's written broadly enough that if you've got outside folks, vendors in there, there's a good chance it would be applicable to you.
Okay, here's an easy one. Are you, I think someone was confused about taking the temperature. Did you mean that the employer needs to be the one who keeps the records each day of the employee's temps, or are they allowed to take their temperature at home and only come in if they don't have a fever?
Well, that's interesting. And let me jump in, and then I'm going to turn it over to Emily. We have clients, and I've read many reports of employers who are actually doing these temperature checks at the beginning of the workday. And if they're going to do that, then whatever record they're keeping is a confidential medical record, all right? And if you happen to test someone who does have fever, you shouldn't announce it to the people behind them that, well, you need to quietly take them to the side and tell them that they've registered as having a temperature and they need to go home, and then come back when they feel better. I have heard clients that are giving that option to the employee to take their own temperature. I guess I'm just a bit concerned about that, because you have no control over the particular, equipment or the device that the employee is using. If something goes wrong and the employee doesn't, operate it correctly and comes into work and they have a fever and they end up getting other people sick, that takes us to Paul's area, the negligence, the gross negligence. So if you're going to do temperature checks, I would recommend that clients, that our chamber members consider doing it themselves at the outset. And that may be part of the survey that Paul mentioned, that, gauge their feeling about a temperature check at the beginning of the workday. You may have employees who say, absolutely not. I think that's an invasion of my, sort of privacy, and you're not going to take my temperature. And do you want to draw the line on a temperature check at the beginning of the workday? I'm not sure you want to do that either. So, Emily, I don't know if you had some other comments on that.
No, I think you're completely right. There's not, I don't think employers are obligated to take employee temperatures by any means. But I think the points that you brought up are completely correct, right? The thermometers vary widely, right? Like, you have no idea what people are using. And I think Paul also brought up an interesting point where people sometimes feel pressured to go to work, even if they are feeling sick. There's always a possibility an employee might, lie or stretch the truth, or be like, oh, it's not that high, it's fine. So yeah, I think it probably is a better idea to do that yourself as an employer. And then, as Mario said, maintain the confidentiality of those records. But yeah, I agree with Mario.
If I can, I'll just chime in and use this to answer another question I saw out there that's closely related to this. And an individual asked, should the temperature check be done in a quasi-private setting instead of folks just standing in a line to get in to the building? That's a very good question. Absolutely, you want to make sure that the temperature checks are done in a spread out manner. You don't want people standing in a line to get into the entrance to your business. That actually would create probably more risk of cross-infection than you're avoiding by the temperature checks. So I would say it's going to be a judgment call, but if you couldn't have people doing those temperature checks in an isolated and a private setting, I would consider not doing the temperature checks.
And Dana,
that gives me sorry, I just wanted to jump in really quickly on that. You may end up with employees that have, for their religious beliefs or something like that, where they would really prefer to have the person who's checking their temperature be of the same gender, or they have it done in a private area. So definitely pay attention to your employees if they are requesting things like that. Accommodate them.
And then my only other comment, Dana, would be that standing time. If you do have a group that has congregated, even social distance wise, and it takes them 7 minutes to get their temperature checked before they can get into their workstation login, that is work time. That cannot be discounted, or you're going to run into a wage and hour issue with the Department of Labor.
Well, thank you so much. I feel like we answered quite a few questions, even though we ran over. I know there are a few more left, and we will work to get those answers and get them to those people who we have contact information for. Some of these are from anonymous attendees, so we won't be able to do that. We will post the slideshow used here, and post this webinar online, so you'll have access to all this information. So thank you so much, Mario, James, Paul, and Emily, the Norton Rose team. Thank you so much for taking time today, and thank you to all of our chamber partners for your continued support of our programming. We recorded today's webinar and we'll post it on the chamber's website, and we will also have tips and answers to some of those questions from today's session posted on our website. We have a couple of upcoming webinars on June 2020. Austin Gibbs Virtual Mixer is Tuesday, June 23rd. Our Senate District 14 Candidate Forum is next Wednesday, June 24th at 2 p.m. With that being said, I want to remind all of you that our community is better when we make our voices heard. Early voting for this Senate District 14 election, as well as the Democratic and Republican primary runoffs, begin on Monday, June 29th. Election Day is Tuesday, July 14th. Learn more at votetexas.gov. Also, 2020 is a census year. Complete the 2020 census at 2020census.gov. Your participation helps to determine how many seats in Congress and how much federal funding the state of Texas will get. Yesterday, Mayor Adler, as we've discussed today, issued an order that directs Austin businesses to come up with a safety plan over the next several days. During this time, the city and county will transition to a more direct order on masks. Businesses in the city of Austin that provide goods or services directly to the public must develop and implement a health and safety policy, including a requirement that all employees and visitors wear face coverings. This order goes into effect on June 23rd, and businesses need to post their health policy so it is visible to employees and visitors. So with that, I think we're finished for today. I want to once again thank all of our panelists and thank Norton Rose and Paul and Mario for putting this together for us. And we hope to see you all soon, if not in person, on a Zoom call. Thank you so much.
Thanks, Dana. Thanks, everybody.
Thank you all.
Thank you all.